Well, the weather's warming up and that means showing a little more leg, but as you break out the shorts, you may notice your veins are more noticeable this year. Well, the experts at the Vein Center say it's a common problem that people start noticing right now, but the good news is they can help. Christy Hafner has more.
There are two main types of superficial veins that bring people into the Vein Center. Spider veins are small, purplish, and squiggly, and in warmer temperatures the veins can dilate, causing a burning or itching sensation. Often spider veins are treated with sclerotherapy. It's a minimally invasive procedure where a solution is injected into the veins. The surgeons at the Vein Center say patients get very good results.
Well, for the spider veins, the sclerotherapy generally gives an average of about 70% results with one treatment. So we're having people think in terms of maybe 2 treatments 6 weeks apart. With that, we can generally get in the 80 to 90% improvement range. For many people, especially since it's private pay, it's not covered by insurance, that's enough for them. Some people want to pursue it further, it's just then very time dependent. If we treat a person and they get a lot of bruising, we may even choose to wait longer than the 6 weeks to do the second round of treatments. So it really gets into several months of a process rather than one particular time.
The other main category is varicose veins. They are large, ropey, and can be very painful. Typically, insurance will cover varicose vein treatment if you meet the requirements.
So the insurance companies require what they call a stocking trial, which is where people have worn good support hose for a period of time to see if that will make their legs feel better. Where that really applied and where that rule was written was back in the old vein stripping days, where the alternative surgery was very difficult and a very hard recovery. Well, as our treatments have gotten much easier, they've kept that requirement in the insurance requirements. But the rule is often not completely definite, and so if a person's worn support hose in the past, say after an operation or when their veins flared up, generally we can add those periods of time together to satisfy the time that they have to wear the support hose.
Patients will have an ultrasound to determine the cause of the vein problem. Often, the saphenous vein is to blame. That's a feeder vein.
If we see a patient who comes in mainly for spider veins, which show on the surface, but they've got quite an extensive network underneath that we think is dilated as well, we think it's very important to do an ultrasound to make sure that the larger, say the saphenous vein, doesn't have problems also, because if the valves aren't working in the saphenous vein, that needs to be attended to first. If the pressure that's allowed into the spider veins in the lower part of the leg is very high because the saphenous hasn't been dealt with first, people get a very poor result from sclerotherapy for the spider veins. So we try to deal with it in that order. The first or larger veins are covered by insurance.
Now the first 10 callers to the Vein Center at 615-269-9007 will receive a free consultation. The Vein Center has 2 convenient locations. You can find them in Belle Meade at 4535 Harding Road in Suite 304. You can reach them there at 615-269-9007. They also have a location in Franklin at 125 Cool Springs Boulevard in Suite 250. Give them a call at that location at 615-503-9895. Again, that's 615-503-9895. And for more information on vein treatments and a link to their website, just go to ours. That's betternashville.com.